just kidding. I'm just kidding. But okay, so Alzheimer's is a form of dementia. There's two abnormal structures that form in the brain as we get older. They're called plaques and tangles, and they're said to just like disrupt. I mean, they grow, so they're disrupting your thinking and your ability to obviously remember and comprehend things. I'm gonna fall now.
You have to left click.
Got it. Then. Okay, so signs. Early onset would be the forgetting the things you recently learned. You're not going to see them until you're probably older in age. I mean, none of you are close to it, I don't think. Probably like, you usually start seeing it in like the late 70s or early 80s. As the disease progresses, you start to see disorientation and confusion, like worsening confusion. They start to make accusations about family members. I know that with my grandma, she would start to make accusations about we were trying to hurt her and what we were doing wasn't in her best interest and stuff like that. So it's kind of disheartening to hear that stuff. They start to become like behavioral. Working in a dementia facility, I've seen it all. Gotten so stuck in my head because they don't know what they're doing. Yes, they're just not themselves. They don't know right from wrong anymore. They don't really remember anything new that they learn. I mean, it could take them 5 minutes. It could take them an hour to forget. It varies. Other than that, I don't know. They're just not themselves. Family members have a hard time seeing it, coming in and seeing their loved ones not remember them or not remember that they were there. Or I've seen that people get accused of not coming and seeing them enough. You know, we were lucky enough with Grandma to not have that. She would remember. Okay, treatments. There's really no cure. Alzheimer's is a kind of a questionable disease because nobody knows anything about it really, other than what it does to you, I guess. But there's no way to figure out how to treat it. They've been searching for years. I mean, obviously Alzheimer's isn't new, so they're gonna keep researching and maybe hopefully find an alternative. There's said to be treatments and drugs that you can take that will slow the progression of the disease, but it's not proven. There's some people it slows it, there's some people that it doesn't. I don't know, their studies aren't really accurate, I guess. Ways to be supportive. It's really important, I think, especially when I see new residents come in, that families are supportive. The ones that just kind of move them in and leave them, you see behaviors a lot worse. I know family members that come and see them often, at least once or twice a week, or even once or twice a month. They do a lot better. They cope with it a lot better. It's really hard for a family to accept Alzheimer's because obviously their loved one isn't the same as what they were. I guess I used my grandma just because we saw huge signs of it. I know it's hard for like the cousins, the grandkids, the children, like everybody to see her go through it. So it's sad, but as long as families are supportive enough, they do a lot better. And it's not like you can't talk to like caregivers, like, you're a caregiver, or were, so you understand. I mean, seeing it, you kind of have a lot of advice to give. I kind of see it more so than you see things that work and things that don't. Everybody's different, so. Alright, so that's my presentation. you guys have any questions?
I have a question.
Alright.
Do young people ever get Alzheimer's? Because I forget a lot of stuff.
I don't think it's really been proven that it's started at a young age. I guess I've never really looked into it. I can find out the answer for you.
Please do.
Okay. Are there any other questions while I answer this?
Well, I was wondering if there was any research that supports or has evidence that shows people with Alzheimer's actually comprehending what they're hearing, and even though they're not responding to you, do they actually hear what you're saying, or are they in tune with what you're saying, or are they remembering?
Like, are they hearing something else?
Are they not even retaining what they're being told or asked? I suppose it depends on the seriousness or
Right.
where they're at within that frame, but, you just wonder at times if they're hearing what you're saying or if they're understanding.
Sometimes, I guess there's different forms of dementia. Like there's, I've seen Lewy body, where like they see things and hear things that aren't there. And that, it's kinda creepy, but it's actually really cool. Like I could say something to that person and they would come back and say something that is so off the wall that you would not, like be so appalled. You would just so taken back by it. But I know, I don't know. I think they hear you and like know what you're saying, but what comes out of their mouth is different than like what they're actually thinking. Like they're like thinking straight. Maybe some people, I don't know. I guess I've not ever had dementia or Alzheimer's, so I guess I don't really know. And it's really hard to get answers from them because they don't know either. But a lot of times, like early set, I've seen them comprehend it at least. You ask them to do something, they'll do it. You ask them to stand up, they'll stand up, but they'll be having a conversation that doesn't even make sense. So I don't know, I guess it depends.
So they might be hearing what you're saying, but unable to tell
Communicate.
you
Yeah.
what they're trying to say.
Yeah. So, your question about younger people having Alzheimer's, Carl? It says that younger onset Alzheimer's affects people younger than age 65. Up to 5% of the more than 5 million Americans with Alzheimer's can be younger onset. I don't think it really starts in like young people, like 20s or younger. This says like 40s and 50s that it starts, but that's really, I've never seen it, I've never heard of it. Yeah, I wouldn't imagine that would.
Okay, I was just curious.
That's a good question. I would be curious to like look into it more.